All righty, let's get started. I'm Kelly Meggs. I'm Vice President of Marketing and Strategy at Tanner, and I'm glad to kick off the beginning session of Workforce Wednesdays. As you know, when you registered, this is just the beginning of several an ongoing series, and we're kicking off today with Dr. Larson. And thank you for everyone being here today. Dr. Larson, for those of you who don't know her, but she's practically COVID famous. She is she's board certified in infectious diseases with Infectious Diseases of West Georgia, which is part of Tanner Medical Group. She serves as the Medical Director of Infection Prevention at Tanner. She also chairs the Carroll County Board of Health. She earned her medical degree at the Mercer University School of Medicine in Macon and completed her internship, residency, and fellowship in infectious diseases at the University of Florida College of Medicine in Gainesville. She and her husband, Dr. Bradley Larson, live in Carrollton. He is a board certified medical oncologist with Northwest Georgia Oncology, and they live in Carrollton with their children. And I appreciate everyone being here. So Dr. Larson, without any further ado, if you'd like to go ahead and get started.
Absolutely. Thank you for everyone that made the time to come. I'm going to talk a little bit about our response with COVID at the beginning and what we did as a hospital system to deal with it. And then I'm going to talk about more of our current statistics and where we are now. So I'm going to share my screen. And so this is the first slide for our Workforce Wednesdays. So who is Tanner? You know, a lot of people know about Tanner, but don't necessarily know a lot of specific statistics, but we're a nonprofit 5-hospital healthcare system serving more than 300,000 people in West Georgia and Eastern Alabama. We have more than 350 physicians representing 34 specialties. When I first came here, there were only about, goodness, I mean, we had less than 100 physicians when I first came in 2004. So we've really grown. We have more than 3,400 employees and more than 30 Tanner Medical Group practices throughout the region. So we have a lot of different parts of the system. We have a cardiac program, we have a stroke center, intensive care services, surgery center, behavioral health, women's care, chest pain centers, and 24-hour emergency departments are all part of our system. We talked about the number of employees. We're up to 491 physicians. We delivered almost 2,000 babies last year, 18,000 surgeries and minor procedures in 2020. We had 15,000 admissions last year, 58,000 urgent care visits, emergency room visits are over 80,000, and a total of almost 270,000 visits to our Tanner Medical Groups last year. So I was sitting in this office where I am right now when we got our first word of 8 patients that were confirmed positive cases. We were looking at our numbers. We would come in every night when this first happened, about 6 p.m. and wait for our labs to come in because the reference lab that we used would have labs come in after 6 p.m. But on March 19th, we had 8 positive cases. We were watching and actually started setting up weekly emergency meetings to talk about what we were going to do and to gear up for care. We immediately started with tents going up near our emergency room departments in Carrollton, Villarica, and Bremen because we really had no idea what volume of patients we would see, and we felt like we needed that adjunct to deal with a rush of medical patients as needed. On March 23rd, we prohibited all visitor access, and hospitals around the whole area were doing that. And some hospitals are still doing that. We have discussed that heavily as a system, and we do believe in a lot of cases having a caregiver in the hospital with patients is an important part of a patient's care. On April 5th, we began providing in-car testing per doctor's order. That was our drive-through, and we were one of the first ones in the area to provide that service. On April 27th, elective surgery resumed, and that was really, I got asked this morning on the radio, when are we going to, push off our elective surgeries now? We noted that it was better for patients if we're able to at least, as long as we know we can staff both elective surgeries and our patient care, having elective surgeries resume is really important because really there are not a lot of elective surgeries out there. Most of the time it's actually people that need surgery that we're just delaying, potentially care as needed. On December 22nd, we got our first shipment of COVID-19 vaccine, and my daughter, my 15-year-old, was with us. And we went down to the pharmacy, and Lynn Barrett and I opened the first box. So it was really exciting time, very emotional time. And we, December 28th, we had administered almost 1,000 first round vaccinations to healthcare staff. By March 17th of 2021, we continued to get shots in arms. And as of July, we've given over 23,000 doses of COVID-19 vaccines to our community. And that's about the time we started seeing the Delta variant enter our community as well, was the beginning of July, because we had essentially a big lull in cases, and that's when things started picking up again. So we had a lot of challenges to taking care of patients. So, we didn't want COVID patients to be sharing waiting rooms with patients that didn't have COVID. And so we launched telehealth early in April of last year, and we screened patients for potential COVID-19. And we used appointments in the hospital emergency departments and walk-in care at Tanner Urgent Care to take care of people. It was really a weird time really early on, because, you just didn't have patients wanting to be seen. People were avoiding clinics, people were avoiding being in the community, people were avoiding the hospitals. And we unintentionally had some people that, neglected their care. It was amazing for the first couple of months when patients started coming back to the hospital, how many patients had neglected important medical problems and had other opportunities for care that we just didn't really expect. We experienced really difficult and long hours by staff members. We really relied on each other, and our patients were, being cared for, but our staff was worried about taking virus home to their families as well. Community support was amazing. That was probably what kept a lot of us really happy and morale good through this, because community came with donations of personal protective equipment, food, thoughts, and prayers. And it was just really nice to live in a community where that happened for us. So vaccines were really important to mitigate the continued spread of COVID-19. We gave resident vaccines to Georgia residents, Tanner team members, at-risk patients, community members, local educators, and kids. We're distributing vaccine in accordance with DPH guidelines, which right now for booster shots are for those who are immune compromised. And we're continuing to do so. We saw a resurgence in people wanting vaccination after the Delta variant had caused increased spread. And I'll show you a graph a little bit of that for what we've been seeing. So the Delta variant is a faster progressing strand. There's a lot of controversy about there as to whether or not it's worse. We don't think it's worse. We think it's just more contagious, and so more people are getting it. It's helpful that people are vaccinated to help prevent severe illness rather than not, but we have had more breakthrough cases in people that are vaccinated. But the important point I want to stress is the breakthrough cases tend to be milder in people that are vaccinated. And what we're seeing hospitalized are most of our patients are actually unvaccinated with our hospitalizations right now. So we continue to recommend washing hands, staying away from people that are sick, getting vaccinated, especially if you're high risk, and isolating yourself from others if you think you have COVID-19 to help control exposure. So this is a really telling graph. Back in the beginning, back in March and April, and that's that far left side of the graph, we really thought that was our peak, and that it was just, it was an incredible amount of patients for us. But then we had a dramatic peak again in July and August of this year. If you look at the third wave, essentially was in December and January, and starting in July on the far right-hand side of the graph is our current wave. We're hopeful that's on the decline now. It seems like it might be in the last couple of days, with our percentage of tests being not as high as they have been, our percentage of positive tests. But you can see our most recent wave has been the most dramatic that we've experienced thus far. We're in a better place of knowing what to do and take care of that. But again, it's terribly overwhelming when we have more patients in the hospital than our hospital is built to accommodate. But we're doing this, and we're hopeful that we're definitely on the decline with that. People always want to know what percentage of people are vaccinated in Carroll County. Right now, that number is 33% are fully vaccinated, and at least 38% have had at least one dose. And this is based on yesterday's report. So we still have a lot of work to do. My hope is that some people do have natural immunity for reinfection if they had COVID previously. There's been a recent study that shows that if you compare natural immunity to vaccinated immunity, you're 2.5 more times more likely to get COVID after natural immunity than vaccinated. Again, we're going to have more information on how protective COVID infections are. That's the only study that we have right now that compares natural immunity to vaccination immunity. So if we look at our current people in the hospital, this is this morning's data. Yesterday, you saw the infographic that we have that Tanner puts out every Tuesday. We had 119 patients hospitalized with COVID-19 yesterday. Today, we have 121 hospitalized with COVID-19. 2 of those persons are vaccinated. We're going to be expanding our information to you on people that are not vaccinated versus those maybe have only gotten 1 dose. We call people that have not gotten, if you have an mRNA vaccine, if you haven't gotten both doses and it's been at least a week or 2 after your 2nd dose, you're not fully vaccinated. And for the Johnson & Johnson, fully vaccinated means 1 dose, 2 weeks after that 1 dose. So it's really important to note that most of the patients we're seeing are truly unvaccinated in the hospital. We have very few that have that are partially vaccinated. What's important to note is in the ICU, none of our patients right now in the COVID-19 and ICU beds are vaccinated. And we've been looking at our deaths since February because that's when we were able to look at our vaccinated deaths versus unvaccinated deaths. And since February of 2021, almost 94% of the deaths we've seen are unvaccinated. So the big point I want to stress about the vaccine is the vaccine, vaccines are typically not designed to prevent the disease as much as to make the disease less severe. And that is certainly the case for COVID-19 vaccination. We're seeing far more people admitted that are unvaccinated than vaccinated, and far more people that are dying unvaccinated than vaccinated. So I'm going to open this up. I'm going to stop sharing the screen and open this up for any questions. And we'll look for questions in the chat, or Kelly, did you want to do any verbal questions or just chat questions?
We had planned on doing chat questions. So if you just have a question there, you just write it in the chat box and we'll discuss it. So I do have a question about boosters. Do you think that we will know in the next couple of weeks when we've moved outside of the immunocompromised group?
I think we're going to know. I think that the scientists that are discussing boosters are discussing whether or not the booster needs to be a reduced dose. As many of you know, there was a small percentage of people getting the mRNA vaccines that develop myositis, which is inflammation of the heart. The spike protein is the protein that was made that's the protein that the vaccine is using for prevention of COVID-19, but the spike protein attaches to what's called an ACE receptor, and those receptors are all in our blood system, in our heart. And so there was a small proportion of patients that were vaccinated that developed pericarditis and myocarditis, inflammation of the heart. So that's the discussion as to whether or not the booster should be lower in people that are immunocompromised or immunocompetent, and whether or not that dose needs to be reduced versus just going ahead and boosting with the current dose. That's my understanding. There is a great question from Grace Pippin, information at the at-home rapid test and the reliability. So the at-home tests are, none of the tests are great for COVID because, number one, our PCR tests are most sensitive. They can be oversensitive because they can be positive for months after COVID infection. That's why we use a 90-day cutoff. For let's say today I test positive for COVID, I test positive 2 months from now, it's the same original infection that I just still have shedding viral RNA. It's not viable viral RNA, but I'm still shedding it. So that's how we use that. So the antigen tests are less sensitive than the PCR tests. So that means they're going to miss they're going to have some false negatives. The home tests are antigen tests, and their sensitivity ranks anywhere from 80 to 90%, which isn't bad, but you have to know, you're the most likely to shed virus the 4th and 5th day into illness. That's when you're most likely to have the largest volume. So it really depends on how symptomatic you are as to whether or not you're going to test positive. And we learned early on with COVID that people that didn't have a lot of respiratory symptoms, there's some people that have just GI symptoms, they almost never test positive with the nasal test. So we were able to detect those people testing positive by antibodies later. So the test, the good number I'd use for sensitivity is 80% for the home rapid tests. They are reliable when they do test positive, but there's a 20% chance you'll test negative. A lot of them, if you notice, come in boxes of 2. So they recommend you go ahead and test once. And if you're still having symptoms, test again, because that'll increase the reliability of detection by testing more than once.
Can you talk a little bit about vaccines in children?
Yes. So right now, the Pfizer vaccine is indicated for people 12 and up. My daughters were enrolled in the Moderna clinical trial. So they were vaccinated in February of this year, and my daughters were 15 and 17 when that happened. We're hoping, we've been told that the Moderna approval will come out any day because that part, I mean, their study is going to be over in February of next year. They're completely done. Pfizer is still enrolling. I believe that they already have the 5 to 11-year-olds enrolled. And then they are still enrolling children, I believe, age 6 months to 5 years. So we're seeing better data from children than we are in adults, at least for the 12 to 17-year-olds with the Pfizer study. There, before Delta, with adults efficacy, it was 94% effective at preventing COVID disease. And for children age 12 to 17 in the clinical studies, it was 100% effective for preventing clinical disease in children. There haven't been a lot of side effects in children noted. And people will always say to me, well, the children are not going to die of COVID, so why should I vaccinate my kids? There are some significant multi-inflammatory syndromes that children have post-COVID. And there are certainly more children that have MIS-C than have severe complications of vaccination. So it's a weight-based rate. Here's the complications of vaccine, here's the complications of COVID, and we're seeing more complications of COVID, even though in children that's a smaller number.
Can you talk about how the median age has changed over time?
Yeah, absolutely.
Going through this process?
Yeah. So what has happened is that initially when we had COVID cases and we didn't have vaccine, we were seeing more people come in over the age of 65, and certainly far more of our deaths in that age range. We have a much higher percentage of people over the age of 65 that are vaccinated. So what has really surprised us is what we're seeing now is the current average age of hospitalization in our hospital with COVID is 59. So that's a much lower age. We had a death this week in a 31-year-old without clinical underlying medical conditions. So what we're seeing is severe disease in younger people because our older population is better vaccinated. So that's been a big change for us to see people coming in and dying much younger, or having most of our hospitalizations and being people much younger than, generally younger than 65. Yeah, Martin brought up a good chat. There are 2 opportunities to receive COVID-19 vaccination this week. On Thursday, September 16th, Carrollton City Schools in partnership with the Rouse Foundation. And on Friday, September 17th at the Carroll County Schools Performing Arts Center. And remember, we have ongoing booster clinics for people that are immunocompromised. And people always ask me what that means. And typically, if I have patients, my HIV patients are considered immune compromised. If you're receiving active chemotherapy, if you are on prednisone, 20 milligrams a day for longer than a month, if you are on things like Humira, Remicade, things that are treatments to suppress the immune system, you are eligible for a booster vaccine. And I don't think that population has to worry about the risk of pericarditis because your immune system is already suppressed. I think it's important to note that over 1 million United States citizens have gotten the booster vaccine. And that's a big number to know if we were going to see terrible complications from it. We already have a lot of people that have gotten the booster and have done well with it. And some of those didn't even necessarily qualify, but were able to get it. So it's really important to remember that there are large numbers of people out there that have, number 1, been vaccinated, and number 2, are getting boosters as well.
We have in the private chat, are you recommending influenza vaccine first or COVID booster first if we have the option?
So that's a really hard question. I think that because flu season is so early right now, we are absolutely seeing influenza right now. And we started seeing influenza cases increase in the last month. And so that's pretty early for us to see that. If you have an opportunity to get the flu vaccine right now, go ahead and get it. The CDC says you can get them together. I personally want to not get mine at the same time because I want to know if I'm going to have a reaction to one or the other. And that's mainly because I have a child that reacts to flu vaccine every year, and I'm very conscious of that reaction. But she gets it every year, and we've figured out how to get it to her where she does very well with it. But, I personally right now would get the flu vaccine first. If you'd asked me that 2 weeks ago, I'd have told you to get the booster first. So I think it just, we've got flu vaccines available now, and we're seeing flu. And if you've never gotten the COVID vaccine, though, I would get the COVID vaccine first. If you had the opportunity, if you've already had COVID vaccine or looking for a booster, I would do the flu vaccine and the booster. But if you've never been vaccinated for COVID, I would get COVID first.
And then someone asked about antibody treatment and who qualifies, when would you get that, where would you get that, kind of what is the process for that?
So the earlier you can get that, the better. It needs to be within the first days of the onset of illness. And if you look on the internet, you can look at Regeneron fact sheet for patients and caregivers. It talks about the medical conditions that increase your risk of progressing to more severe COVID. One of the most common risk factors is a body mass index over 25. And that's really, 25 is a normal BMI. So over 25 is just considered overweight. So if you're overweight, you qualify for the monoclonal antibody. Diabetes, heart conditions, lung conditions, neurological diseases, they're all listed there, but those conditions put you at an increased risk for complications of COVID, especially if you're unvaccinated. So if you do have those conditions and you are within that first 10 days of the onset of illness, contact your primary care provider about getting you set up. It's important to note that we are having to waitlist people more. So if you have a concern, contact your provider early because we're having to have people wait for getting the monoclonal antibody over the, it may not be able to be given to you the same day. So it's really important to work on that early. So long COVID, any information or resources. So there are 4 long COVID clinics in the state of Georgia. They're almost all in Atlanta. And we've had a little bit of insight on how to treat it. It's really interesting that people that have long COVID have a lot of neurological symptoms or what they call brain fog. A lot of them can have long-term shortness of breath or chest discomfort, even with normal pulmonary function tests. We've had people that have new cardiac derangements like hypertension and then palpitations that they never had before, that they now have that after COVID infection. So we don't have a lot of good information or resources. We're still in the learning stage of that, but we have a better understanding that it happens. Initially it was, whether or not this truly was a condition. I think it truly is a condition, but we just don't have a lot of treatment resources available for it. We're treating essentially symptomatically. We're having some good information come out on some of the selective serotonin reuptake inhibitors, or SSRIs, which were classically used to treat anxiety and depression. And then, Cymbalta is a medication we've used for chronic pain that helps reset people that have had chronic pain and chronic illnesses too. So it's really kind of unless you are enrolling in one of these specific long COVID clinics, you're probably going to be treated symptomatically by your doctor.
Can you talk a little bit about the importance of making sure you get that second shot, sort of what happens with the first shot, what happens with the second one, and what will happen with the booster?
Yeah. So if you have an mRNA vaccine, that is a 2-shot series. And the reason for that is that it was meant to be given in smaller doses over a longer period of time because larger doses could potentially have more side effects. So you get a single shot, and then if you get the single shot, your efficacy is about 70 to 74% at preventing COVID. But if you get that second shot, your immune system has already been primed. And that's essentially kind of that second shot is a booster at saying, okay, you've seen this before. This is, something that's foreign that you want to increase your antibody production to and produce memory B and T cells to be able to identify this in the future and reduce that chance that infection is going to take hold in your body. So that's how the mRNA vaccines work, is one is a primer and then the second is a booster. So we do know that in some people that their immune system does not have long-term efficacy. So people that have immunosuppression may not have protective antibody or generate as many memory cells that can fight infection in the future. And so that's why it's important for them to get a third vaccine to, again, essentially it's telling the immune system just to relearn, hey, this is foreign and this is something that you're going to want to fight off going forward. We know that J&J is talking about offering a booster, whether or not it needs to be with J&J versus another vaccine. That information is coming. We know that based on a lot of data coming out of Israel that we started to see breakthrough cases. And that's why recommendation was in that country to go ahead and boost everybody above the age of 65. And they've seen a reduction in hospitalizations and other illnesses as well. So, we're still learning as we go. But I think, it's important to note that at least the mRNA vaccines are designed to be lower dose with a repeat in order for your immune system to be able to be retrained. Novavax, which I know I've talked a lot about Novavax, that is a vaccination that is made just like the traditional flu vaccination, and it's going to be a 2-shot series as well. That company is in the United States, but it has been licensed or pursuing licensure in countries that don't have a lot of vaccine already. We forget that we're very fortunate in the United States that we have a lot of vaccine. We've been giving it to other countries, but that Novavax has not gone for licensure in the United States yet because of wanting to make sure that other countries have access to that as well.
Does anybody have any other questions for Dr. Larson? We really appreciate everyone on the call today. Next week will be our next topic. It'll be Tammy Turner, who's a nurse with our occupational health department, and she is going to go over how you can keep your employee about vaccinations, but also how you can keep your employees safe during this time of COVID. And it seems now that our post-COVID workplace seminar the title is somewhat ironic. So please look on the Tanner's website if you need any information about how you can keep your employees safe, about upcoming sessions to this webinar, which we have a lot of good topics coming up, and you can still register, and please share that information. And then after the meeting is over, we will send out a recap email that just has the information about where you can go if you know someone who is immunocompromised to get a vaccine this week. And registration is still open for both of those. So please share. This will be recorded and we'll post it on our website later on. So thank you very much. If no one has any other questions, we can wrap up and you get 30 minutes back of your day.